Talk about how doctors help couples dealing with infertility. And joining me to talk about this is Dr. Juan Alvarez, a reproductive endocrinologist and infertility specialist at Conceptions, Florida. Welcome to Smart Life. Doctor, I love that name, Conceptions, Florida.
Yes.
So appropriate for what you're doing.
Very appropriate.
Can you tell us a little bit about what you do?
Yes, as an infertility specialist, we see couples who are struggling to get pregnant in the office to sort of do a workup to see why that's happening.
Okay. Today we're going to focus on infertility mostly. Can you explain a little bit about infertility for those who might not know what that means?
Yes, so the definition of infertility is a couple trying to get pregnant by unprotected intercourse for 12 months without success. And the reason why it's 12 months is because we know through population data that about 80% of couples after 6 months of trying will get pregnant, and about 90% will get pregnant after 12 months of trying.
I was going to ask you, how do you know if a couple is infertile? I guess after a year of trying and nothing happening, but that's not a sure sign that they're infertile. You have to do further tests?
Yes, we do. And when a couple comes in to do a fertility evaluation, usually we start with the female patient. So we do something that's called ovarian reserve testing to see how many eggs the woman has. Because biology, women are born with all the eggs that they're going to have. So it's a finite number.
There's a finite number, okay.
Yes, and throughout the reproductive years, that number starts to go down. So the proportion of good quality eggs and bad quality eggs start to rise.
Okay.
And so we really need to know that by doing some hormone testing and some pelvic ultrasounds. For the man, we usually do a semen analysis, which shows us concentration of sperm, how many of the sperm are moving, how many of them look normal. And this evaluation really helps us to get down to the reason why.
Are most infertility cases, are they treatable?
Most are treatable. Now, the diagnoses that are very difficult to treat are usually premature ovarian failure, or a young woman who have very little number of eggs, or azospermia, so no sperm in the ejaculate. Those are the more difficult cases, but other than that, most of the time is some problems with ovulation, which we have drug medications for that.
What can a couple do to increase their fertility chances? Is there such a thing they can do actually to be more fertile?
Yes, so there is a fertility window, and that's usually 6 days before ovulation. So what I counsel my patients on is to have intercourse about every other day, 6 months prior to knowing when a woman's going to ovulate, and that is very simple thing that a woman can do at home by either doing an ovulation predictor kit, which you can buy in any pharmacy, and then that will really predict when you're going to ovulate to try to time. But most of the time, I tell my patients, just have fun, try, most studies show that if a couple is, trying to conceive every 2 days, somewhere around the middle of the cycle is usually optimal time.
Talking about that, you always hear about people who've been trying and trying to get pregnant, and let's say for the last year or 2 years or whatever, and they say the moment they stop trying is when they get pregnant. I guess stress is involved? There's stress factors involved as well?
Yes, so extreme stress can lead to a woman to not ovulate. So extreme weight loss or exercising really hard, like a ballerina or a skate figure. But stress in itself can lead to lower frequency of coitus. So stress can lead to factors that can lead to infertility.
Why is it more difficult for women to conceive at a certain age, for example?
Well, that's because after age 35, most women will start a decline in their fertility because, like I said, of that finite number of eggs.
Okay.
So that every ovulatory cycle is not very optimal. So as the egg count starts to go down, every ovulatory cycle is not the optimal cycle to get pregnant. And that's why it becomes more difficult to conceive.
So it also has to do with the amount of sperm in the ejaculation, and then the number of eggs and the eggs, that particular cycle that they're involved in.
Yes, correct. So a very simple test if if a couple has been trying for a couple of months, if the woman has regular cycles, there really is no indication to testing other than if a woman has irregular periods, definitely go to your gynecologist to see why that's happening, because that may indicate that there is some problem trying to get pregnant. For men, there really is no indication as amount of ejaculate that says one is fertile, one is infertile. So a simple semen analysis is very helpful.
Are there any diets or lifestyle that would help fertility?
Yeah, so we know that extreme of weights can cause infertility. So someone who is very underweight or somebody who is very overweight. So having a balanced, healthy diet really, really helps, and to maintain your body, your weight at a certain amount that is for your height. So we call that BMI. Exactly. So BMI less than 25 is considered to be a normal BMI. So no specific diet that I would recommend. I always tell my patients if they want to lose weight to decrease their calories to about 1,500 kilocalories per day, and to maintain a healthy diet with lean meats, vegetables, fruits, not to be too restrictive, and definitely some lifestyle modifications such as smoking. We know that smoking can cause infertility. We know that women who smoke go into early menopause, and that's because of the quality of the eggs.
Okay, how about drinking? I'm sorry.
Yes, drinking. I was going to get to that. Definitely try not to drink more than 3 drinks per week. That's why I recommend my patients. Now, there's not a lot of data concerning how much drinking is safe, how much drinking is not safe, but drinking a lot, meaning more than 5 drinks in a week, that's heavy drinking.
Okay, so no smoking, cut down the smoking, cut down the drinking to increase the chances. What are some of the infertility treatments, and what are the outcomes?
Yes. So depending on the diagnosis for the couple, what we try to do is give fertility drugs so that a woman ovulates more than 1 egg in a month to increase the probability that she's going to get pregnant. Now, this does increase the chances of getting twins, but it's slight, like about 10%. And then on top of that, we can do artificial inseminations. If that doesn't work, or if there's a different diagnosis where there's severe low sperm count or severe low egg number, we can do in vitro fertilization. And with that process, we stimulate the ovaries to extract eggs outside of the body, fertilize them outside in the lab, and then transfer back embryos to the patient's uterus to get pregnant.
Wow, sounds like science fiction, but it's reality nowadays.
Exactly.
Wow, amazing. Dr. Alves, thank you so much for coming on
Thank
to
you for
Smart
having
Life.
me.
It was great having you.
More Smart Life after this.
For Nora Delgado, it's family first, then her yoga practice.
We go there not for our body, we go for our minds. It really transforms you from within.
But when Nora was diagnosed with breast cancer, it turned her world upside down.
In America, we diagnose 250,000 women with breast cancer every year.
Now there's some good news for the thousands of women battling this disease, thanks to the TAILOR-X trial. Dr. Alejandra Perez at the University of Miami says the study enrolled 10,000 women with early-stage breast cancer.
They are hormone receptor positive and HER2 negative, and they have no lymph node involvement.
The patient's tumors were tested with the Oncotype DX test to determine the chance of recurrence.
Based on that recurrence score, you're assigned into the low-risk category, intermediate group, or high risk.
The patients who scored in the middle were split into 2 groups.
One got hormonal therapy with chemotherapy, and the other one just got hormonal therapy.
What they found was remarkable.
If you look at overall survival, was 98% for both groups. That means that 70% of women, we can avoid chemotherapy.
Nora's score revealed she did not need chemo.
I was very, very lucky. I won the lotto on that day.
She chose to have a double mastectomy and is now on hormone therapy for 5 years.
I'm really grateful and happy, content.
Finding peace in her life once again. I'm Marty Salt reporting.
You have a question? We've got the answers. Stay tuned for our Ask the Experts segment.
You're watching The Smart Life on the Health Channel on South Florida PBS.